We've come through a very, very difficult preparatory first wave of COVID-19. We've seen the challenges that it's presented around the rest of the world, and we've ramped up our capacity, both in terms of hospital beds, in terms of ICU beds, ventilators, and also obviously the frontline response through primary care and the respiratory clinics around the nation. We've increased our testing capacity significantly, and we've got significant contact tracing in the community. And we've identified that in terms of community transmission, we're at a level to start to explore a gradual, sensible, and appropriately paced release from some of those restriction measures. But it must be borne in mind that obviously in different parts of the country, we're at different stages. Some states have not recorded any cases for nearly 2 weeks or more. So we've got to, it'll be at different paces at different parts of that country, but we've still got local outbreaks, and those outbreaks in some areas are obviously going to determine the responses of those particular states as we come out of those restrictions. But yes, let's have a look at that. The Australian public has done enormously well in terms of the social distancing requirements and the measures that it's put into place. And now is the time to start to look at how we can start to gradually and sensibly take some of those measures off. But at each stage, testing and seeing what kind of responses we get over a 4-week period between each progressive release or improvement in those restrictions.
Okay, let's look at what stage one might look at. What are you comfortable with being lifted in the next 4 weeks?
So it's not so much what I'm comfortable with. It's obviously will be informed by all the appropriate medical experts. But the sensible, if we look at the way we entered into the current phase of restrictions, it'll be gradually the reverse of that. Obviously, if we look at where we'll end up eventually, and that's mass gathering. So clearly that's not even contemplated at the moment. But if we look at an increase in the number of people that can get together at a social in a social little group, from increasing from 2 in some parts of the country, of some states at the moment, up to 3 or 4, keeping that social distancing measure in terms of the distance. If we look at the appropriate family gatherings, and if we look at also social outings and the congregations on streets in terms of for coffees at pubs, at cafes, you might be saying that they're progressively the next step on each other in terms of where to next. But certainly it's going to be a while before we can look at anything like pubs and clubs, nightclubs. Gymnasiums are probably somewhere in between all of the second or the third phase, depending on the evidence and what's going on at that state level. But they're the types of things. Clearly, international travel is not something that's going to be on the agenda anytime this year, most likely. And it's really going to be up to the evolution of a vaccine before we can start to see that kind of return.